heart failure rarely starts with chest pain. It whispers long before it shouts. You see, once you're over 60, your heart enters a new stage of life, and the very first signs of trouble are almost never dramatic. They're subtle, quiet, and incredibly easy to mistake for just getting older. But here's the truth I want you to hear right now. Your body always gives warnings. Most people simply don't know what to look for. For over 20 years, I've helped older adults strengthen their hearts, catch disease early, and stay active well into their 70s, 80s, even their 90s. And if there's one thing I've learned, it's this: the most dangerous symptoms are the ones you ignore. That's why today I'm going to walk you through 5 hidden signs of heart failure that most seniors miss. The signs I wish every patient over 60 understood. Signs that, if caught early, can help you protect your heart, stay independent, and live the life you love for years longer. Some of these symptoms might surprise you. Some may be things you've brushed off for months, even years. But by the end of this video, you're going to see them in a completely new light. And make sure you stay with me until the end, because I've prepared a simple doctor's home checklist you can start using tonight to track your heart health and catch early warning signs before they become emergencies. Let's begin, because your heart is talking, and today you're going to learn how to hear it. Before we dive into the hidden signs, I want to explain something important, something that many people misunderstand. Because to protect yourself, you need to understand what's really happening inside your body. Most people think heart failure is sudden. They imagine a dramatic collapse, pain, panic. But that's not heart failure. That's a heart attack. A heart attack is when a blood vessel gets blocked suddenly. It's fast, it's intense, and it's usually unmistakable. Heart failure, on the other hand, is very different. It's not a sudden event. It's a slow, gradual weakening of the heart over months, sometimes years. The heart becomes weaker at pumping blood, so fluid slowly builds up in the lungs, the legs, the abdomen. Your organs begin to receive less oxygen. Your muscles tire faster. Your body works harder, even when you're not. And because it happens so gradually, many seniors never notice the early signs at all. In fact, most people don't realize their heart is struggling because the symptoms feel so ordinary. Think about it. You feel a little more tired than usual. You breathe a little heavier walking up the stairs. Your ankles swell a bit at the end of the day. You sleep with an extra pillow. All of these seem normal, right? Just getting older, just slowing down, just a long day. But as a doctor, I can tell you this. There's a difference between aging and illness. And heart failure hides in that gray area where the two overlap. This is why early detection is so powerful, because the earlier we catch heart failure, the more treatment options we have. Medications work better, lifestyle changes make a bigger impact, hospitalizations can be prevented, and quality of life, your ability to walk, travel, cook, garden, play with grandkids, stays dramatically higher. I've seen patients who caught it early go on to live long, active, meaningful lives. And I've seen others who didn't recognize the signs until it was too late. But you are here. You are learning. You are taking charge of your health. And that alone puts you miles ahead. So now that you understand why heart failure is often missed, let's talk about the part that matters most, the 5 hidden symptoms your body uses to warn you. The signs that reveal your heart is working harder than it should. Let's start with the very first, and one of the most commonly ignored. Let's start with the very first hidden sign, and one of the most common reasons my older patients come to see me, but almost none of them realize it's connected to their heart. Unexplained fatigue, a deep, persistent loss of energy. Not the normal I didn't sleep well tired, not I had a busy day tired. I'm talking about a fatigue that feels different, stronger, heavier, more constant. Here's why it happens. When your heart begins to weaken, even just a little, it can't pump blood as effectively. That means less oxygen reaches your muscles, less oxygen reaches your brain, and your entire body has to fight harder just to get through the day. Imagine your heart as a pump. If that pump is strong, everything flows easily. If that pump weakens, every system in your body feels the strain. And here's the tricky part. Because this change is slow, many seniors don't notice it, or they simply explain it away. They'll tell me things like, "Doctor, I guess I'm just getting old. I don't have the energy I used to. I get tired so quickly now. but I thought that was normal. But it's not always just age. Sometimes it's your heart whispering for help. You might notice small changes at first. Feeling tired after simple tasks like making the bed, running out of energy halfway through your morning walk, needing to rest after loading the dishwasher, losing stamina you used to have, feeling sleepy unusually early in the evening, or needing naps, even when you slept a full night. These may seem harmless, but they're often the earliest signs of low cardiac output. I once had a patient. Let's call her Mary. Mary was 72, active, loved gardening. She came in because she thought she was just slowing down. She told me, "Doctor, I don't understand. I used to garden for hours. Now I pull a few weeds and I'm exhausted." She assumed it was aging, but her heart was quietly struggling. Her early fatigue was the first sign of developing heart failure. And here's the important part. Because she caught it early, we were able to treat it aggressively, adjust her lifestyle, and protect her heart. Today, she's back to gardening, even leading a community group. I've seen the opposite too. Patients who ignored that early fatigue for years, only to come in once the symptoms became severe. By then, it's harder to manage, harder to reverse, harder to live the life they want. So here's what I want you to take from this. Fatigue that feels new, persistent, or out of proportion to your activity is a warning sign. It's your body's way of saying, something isn't right, pay attention. If you notice that your energy level has changed, not just for a day or two, but week after week, don't dismiss it. Don't blame it on age. Don't ignore it, and push through. Your heart might be asking for help, and the sooner you listen, the more you can do to protect your future. Now let's move on to hidden sign number 2, a symptom many seniors overlook until it becomes impossible to ignore. The second hidden sign is something many seniors feel, but almost none of them connect with heart failure, and that is shortness of breath, especially when you're not exercising. Now, of course, we all get a little winded after climbing stairs or carrying groceries, but heart-related breathlessness is different. It shows up during the moments when breathing should be easy. Let me walk you through the patterns most people miss. Many seniors tell me they fall asleep fine. But the moment they lie flat, they feel pressure in their chest, a heaviness, a sense that the air isn't moving in as easily. This happens because when your heart weakens, fluid begins to back up into the lungs. Lying flat spreads that fluid evenly across the lungs, making it harder for oxygen to move in and out. Some people even describe it as drowning from the inside. This one is frightening, and it's a classic early sign. You're asleep. Everything is calm. And suddenly you wake up, gasping, panicked, struggling to take a deep breath. Most people think it's a nightmare, or anxiety, or just one of those nights. But often it's not. It's the heart failing to keep fluid out of the lungs while you sleep. When your heart can't pump efficiently, fluid rises during the night, reducing the space your lungs have to expand. Your body forces you awake because it needs air. Another overlooked sign is getting winded after activities that used to feel effortless. A short walk to the mailbox, light sweeping in the kitchen, getting dressed, climbing 1 or 2 steps, talking while walking. If you find yourself pausing to catch your breath more often or avoiding certain tasks because they drain you, your heart may be struggling to keep up. This is a very distinct feeling my patients describe. Not pain, not dizziness, but a sense that breathing feels shallow, like you're not pulling in enough air, or like something is restricting your lungs. It often appears in quiet moments, sitting, resting, or talking on the phone, and because it seems so random, many people brush it off. Here's a simple test. If you used to sleep with 1 pillow and now you need 2, 3, even 4 just to breathe comfortably, that's a red flag. Many seniors gradually add pillows without even realizing why. They think it's comfort, but it's actually the body trying to keep fluid low in the lungs, so breathing becomes easier. Let me explain this simply. When the heart becomes weaker, it can't pump blood forward as effectively. So the blood backs up, first into the veins, then into the lungs, then into the air spaces where oxygen should be. This is why breathing becomes difficult. Not because your lungs are failing, but because your heart is. And this kind of breathlessness is not normal aging. It is one of the clearest early signs of developing heart failure. If you're noticing any of these changes, even mild ones, please don't ignore them. Breath should come naturally. It should be effortless. If it's not, your heart may be trying to tell you something. Now that we've covered breathlessness, let's move on to hidden sign number 3. And this one is something many seniors see every day, but almost no one connects it to their heart. The third hidden sign of heart failure is one almost every senior has seen, but almost no one recognizes as a warning: swelling, especially in the feet, the ankles, or even the abdomen. Many people simply call it water weight or blame it on standing too long or assume it's just a normal part of getting older. But here's the truth: new or worsening swelling is never something to ignore. To understand this symptom, picture the heart as the body's main pump. When that pump weakens, it cannot move blood forward as quickly, so blood begins to back up in the veins. This pressure forces fluid out of the blood vessels and into the surrounding tissues, especially in the lower parts of the body where gravity keeps blood pooling. That's why swelling often starts in feet, ankles, lower legs, and later, the abdomen. This buildup of fluid is called edema, and it's one of the most common early signs of heart failure. You may notice your shoes suddenly fitting tighter, or that the elastic from your socks leaves deep marks in your skin. That's not just swelling from a long day, it's your body trapping fluid because the heart isn't pumping efficiently. This is a key clue doctors look for. If you gently press your finger into your ankle or shin, and the indentation stays for a few seconds before filling back in, that's called pitting edema. Pitting edema almost always means there is fluid retention, and very often it is related to the heart. Another sign many seniors overlook: gaining 2 to 3 pounds overnight or 5 to 7 pounds in a short week without eating differently. This is not real weight. It's fluid your body is holding on to because your heart can't push it out effectively. That sudden jump on the scale is your heart trying to tell you something. Swelling caused by heart failure tends to be new, persistent, worse in the evening, better in the morning, gradually spreading higher over time. If you notice swelling that is getting worse, happens every day, is new for you, or is spreading past the ankles, please don't ignore it. This is one of the most visible signs that your heart may be struggling. New swelling is never normal. New swelling is a signal. And the earlier you address it, the more we can do to prevent complications, protect your heart, and keep you living independently. Now let's move on to hidden sign number 4, a symptom many seniors mistake for a cold or allergies, but it often reveals much more than that. The fourth hidden sign is one that surprises a lot of people, a symptom almost every senior experiences at some point, but very few connect to their heart: a persistent cough or unexplained wheezing. Most people assume they caught a cold, or allergies flaring up, or that dry tickle in the throat that just won't go away. But sometimes that cough isn't coming from your throat at all. It's coming from your heart. When your heart begins to weaken, it can't pump blood forward efficiently. So blood backs up into the lungs. And when fluid seeps into the lung tissues, even just a little, your body tries to clear it. That clearing reflex creates what doctors call a cardiac cough. Not because your lungs are infected, but because they're wet. A cough that wakes you up or gets worse after lying down is a classic sign of fluid in the lungs. Gravity shifts when you lie flat, so the fluid spreads across a larger area, triggering coughing spells. This is often not a cold. It's your heart struggling overnight. This one is rare, but when it happens, it's serious. If the mucus you cough up looks pink, bubbly, or frothy, it means fluid is mixing with air in your lungs. This is a medical emergency. Call 911 or go to the ER immediately. If you suddenly develop wheezing, a soft whistling sound when you breathe, and you've never had asthma or lung problems, your heart may be the cause. Fluid in the lungs narrows the airways, creating that wheezing sound. If you lie down to sleep and start coughing, or you need to sit up to calm your breathing, this is another sign that fluid is building up. Many people think must be allergies, maybe dust, just dry air. But often it's the heart sending warnings. Here's what I tell my patients. Call your doctor right away if you have a cough lasting more than 2 weeks, a cough that keeps waking you up, wheezing you've never had before, sudden weight gain along with coughing, shortness of breath and coughing, swelling in your legs plus new coughing, coughing that gets worse when lying down, and get emergency care if you ever notice. Pink or frothy sputum, severe breathlessness, chest pressure or dizziness, coughing so hard you can't speak in full sentences. These symptoms don't always mean heart failure, but when they do, catching them early can prevent hospitalization, protect your lungs, and reduce dangerous fluid buildup. So if your cough feels new, different, persistent, or just doesn't make sense, don't ignore it. Your heart may be speaking through your lungs. Next, we'll talk about hidden sign number 5, and this one involves your heartbeat itself, something many seniors feel, but almost no one understands. Hidden sign number 5 is one many seniors feel, but few understand, and it's directly connected to how hard your heart is working. A fast, irregular, or pounding heartbeat. Some people describe it as fluttering, others say it feels like skipping beats, and some feel a pounding pulse in the neck or chest. Whatever it feels like, it's your heart sending a very clear message. I'm struggling, and I'm trying to compensate. When the heart becomes weaker, it can't pump enough blood to meet the body's needs. So it tries to make up for that weakness by beating faster, harder, less regularly. It's the heart's version of stepping on the gas pedal to keep the car moving, even when the engine is failing. But this extra effort comes at a cost. Over time, it wears the heart out even more. Many describe it as a butterfly feeling or a soft vibration under the breastbone. It comes and goes, and often happens when sitting quietly. You may feel like your heart pauses, then suddenly thumps hard to catch up. This is the heart misfiring, a sign of electrical instability. Some seniors tell me they see or feel a visible pulsing in their neck or throat, especially when lying down. This happens when the heart pumps harder than usual to overcome its own weakness. If you notice your heart racing after light housework, a short walk, talking while moving, standing up quickly, climbing a few steps, that's not normal aging. It's the heart struggling to keep up. Your heart shouldn't feel like it's running a marathon when you're simply living your everyday life. One of the most important points is this. Heart failure and atrial fibrillation often go hand in hand. Atrial fibrillation, or AFib, is an irregular, chaotic heartbeat. It's extremely common in adults over 60, and even more common in those with weakened hearts. When AFib and heart failure occur together, the heart becomes less efficient. Blood flow weakens, blood clots can form, stroke risk increases, symptoms worsen quickly. This combination is serious, but highly treatable when caught early. Call your doctor if you notice frequent palpitations, an irregular heartbeat, heart racing without exercise, fluttering or thumping sensations, a pulse that feels uneven or unpredictable, and seek immediate care if you experience heart racing over 120 beats per minute at rest, chest discomfort, dizziness or fainting, shortness of breath with a racing heartbeat. These symptoms don't mean your heart is failing, but they do mean your heart is working harder than it should. And the sooner we understand why, the sooner we can protect it. Now that we've gone through all 5 hidden signs, we're going to bring everything together. In the next part, I'll give you a simple doctor's home checklist you can use every day to track your heart health and catch problems before they escalate. Let's move on. Now that you understand the 5 hidden signs, I want to give you something practical, something you can start using tonight. A simple doctor-approved home heart check checklist. This is the same tool I use with many of my patients over 60 to catch early warning signs long before they become emergencies. And the best part? It takes less than 2 minutes a day. Let's walk through it together. Every morning, before breakfast, before coffee, step on the scale. Like if your weight goes up more than 2 pounds in 24 hours or more than 5 pounds in a week, that's a sign your body is holding on to fluid. Fluid gain is often the earliest sign that heart failure is progressing. After you get dressed, look at your ankles. Do your socks leave deeper marks than usual? Do your shoes feel tighter? Do your legs feel heavier by the end of the day? If the swelling is new or happens daily, your heart may be struggling to move fluid properly. Before bedtime, take note. How many pillows do you need to sleep comfortably? 1, 2, 3? If that number has increased, or if you need to sleep partially upright just to breathe easily, that's a sign fluid may be building up in your lungs. Once a day, rate your breathing on a simple scale. 0 equals breathing feels normal, 5 equals breathing feels difficult or uncomfortable. If your number starts creeping higher, even slowly, That's important information your doctor needs to know. At the end of the day, ask yourself, how was my energy today? Normal, a little low, very low, exhausted after simple tasks. If your energy is dropping consistently for a week or more, your heart may be delivering less oxygen to your muscles. You don't need equipment for this, just awareness. Do you feel fluttering, skipping beats, a racing heartbeat at rest, a strong pulsing sensation in the neck or chest? These sensations, even if brief, should be written down. I'll include a printable version of this checklist so you can keep it on your nightstand or refrigerator. Just a quick daily check, 2 minutes, that's all, can help you catch problems early, protect your heart, and give your doctor the information they need to keep you healthy. You deserve to understand your body. You deserve to stay independent. And this simple checklist is one of the easiest ways to do that. Now, let's talk about what to do if you notice something concerning. Now that you know the signs, what should you do if you start noticing any of them in your own life? The most important thing I want you to remember is this: do not self-diagnose. These symptoms can have many causes, some serious, some less serious, and only a medical professional can tell the difference. But if you're noticing new fatigue, shortness of breath, swelling, persistent coughing, or irregular heartbeats, please don't wait. Don't assume it's normal aging. Don't ignore it and hope it goes away. The earlier we understand what's going on, the more we can do to protect your independence and your long-term health. When you come in, your doctor will run a few simple, painless tests that tell us exactly how your heart is performing. This is an ultrasound of your heart. It shows how well your heart is pumping and whether any fluid is backing up. BNP is a blood test that rises when your heart is under stress or when fluid builds up in the body. It's one of the fastest ways to detect early heart failure. This checks your heart's electrical rhythm and helps us find irregular beats like atrial fibrillation. This shows whether there's fluid in the lungs and whether the heart is enlarged. None of these tests are painful. Many take only a few minutes, but together they can reveal problems long before symptoms become severe. Heart failure caught early is highly manageable. With the right medications, lifestyle adjustments, and monitoring, many seniors live long, active, fulfilling lives. Early detection means fewer hospital visits, fewer emergencies, more treatment options, better energy, better breathing, better quality of life. So if something feels different, if something feels off, listen to it. Take action. Your heart will thank you for it. Heart failure is serious, but it is not hopeless. The truth is, your heart gives you warning signs long before things become dangerous. And when you listen to those signs, when you take action early, you give yourself the best chance to stay strong, independent, and active for years to come. I've seen patients turn their health around simply because they paid attention, because they trusted their instincts, because they didn't ignore what their body was trying to say. And you can do the same. So I want to encourage you, gently but firmly, listen to your body. If something feels new, if something feels off, don't brush it aside. You deserve answers, and you deserve care. Before you go, I'd love to hear from you. Which of the 5 hidden symptoms surprised you the most? Tell me in the comments below. I rate every single one. And if you know someone over 60, a friend, a parent, a neighbor, please share this video with them. You might truly help someone catch a problem early. And if you found today's video helpful, make sure to subscribe for more heart health guidance, practical tips, and doctor-led advice you can trust. Thank you for watching. Take care of your heart, and it will take care of you.